What is intermittent fasting?
The intermittent fasting is an eating pattern that alternates periods of eating with periods of fasting. Popular methods include the 16-8 method, fasting for 16 hours and eating within an 8-hour window, and the 5-2 diet, which involves eating normally for 5 days and restricting calories for 2. The goal is to help manage weight and improve health by allowing the body to rest between meals.
Does intermittent fasting help with weight loss?
Scientific studies suggest intermittent fasting can promote weight loss by reducing calorie intake and encouraging the body to burn stored fat. Many people find it easier to reduce calories without strict dieting. However, long-term success depends on individual lifestyle, food choices, and adherence to the fasting schedule. Like any dietary approach, results vary and it may not work for everyone.
Are there other health benefits?
Research indicates potential benefits beyond weight loss. Intermittent fasting may improve insulin sensitivity, lower blood sugar, and reduce inflammation. Some studies suggest it might support heart and brain health. However, many findings are based on short-term or animal studies. More research is needed to fully understand its effects on long-term human health.
Is intermittent fasting safe?
For most healthy adults, intermittent fasting is considered safe. However, some people may experience hunger, fatigue, or irritability, especially in the beginning. It is not recommended for children, pregnant or breastfeeding women, or individuals with certain medical conditions, such as diabetes, unless supervised by a healthcare professional. Consulting a doctor before starting is a wise precaution.
Who should consider or avoid intermittent fasting?
People considering intermittent fasting should assess their health needs and consult a professional if unsure. It may be a helpful option for those seeking a structured eating pattern to manage weight or improve metabolic markers. However, it should be avoided by individuals with a history of eating disorders, those underweight, or anyone with medical conditions requiring regular meals.
Key takeaways.
Intermittent fasting is an evidence-based tool for some people seeking weight management and health improvements. While research supports several benefits, it is not a universal solution. Safety and effectiveness depend on individual health needs and preferences. For best results, combine intermittent fasting with balanced nutrition and regular physical activity, and seek expert guidance for any concerns.